things like this used to be thousands and thousands and thousands of dollars. Now typically they're $700 or $800 or $600 for something that used to be $2,000. So prices are coming down, which is amazing. And this young lady from Atlanta, Georgia, have you had this before or no?
Nope.
First time.
Just laser hair removal.
Just laser hair removal. So if she jumps off the table, no, that should be fine. Just I don't think it hurts. I'm not sure. Does it hurt?
No, it doesn't. It has a tip, a disposable tip that I attach to it. Each tip has 64 little pinpoint pricks. It's 64 little electrodes. So they go down into the dermis and they cause a thermal injury. So once it hits the dermis, it expands. And if women don't know this, you should. We stop producing collagen at age 21. So anytime I see a cute little 21-year-old, I'm like, that's as good as it's going to get, girl. It's only downhill from there. Yes, we are born. This is what I've learned. We are born with so much collagen when we're born, and our need for it is really, really low. So as we start to age, our need for it grows, and our body's ability to produce it starts to dissipate. And when you hit 21, there's a balance, right? And then you continue to age, and your body's need for it grows, and your body's ability to make it starts to decrease. So you have to do things to stimulate collagen. So by causing a thermal injury, or doing Botox, or injecting hyaluronic acid, and using a growth factor in your skincare, things that are going to help produce collagen are things that are going to help you produce collagen. So you can find a balance. You've got to balance your collagen by doing these things. Otherwise, we can age, but we can age gracefully. So remember that, okay? Now, how old are you, Whitney?
26.
Oh, she's a baby. She's still 26. Okay. So the great thing about this procedure is I don't use any protective lenses. It's radio frequency. We have other procedures in our office. There are laser procedures that you have to wear goggles with, or I have to apply gel. But this is a very simple procedure. They just get to lay back, close their eyes, and then I start. Ready? So I want you to sit up a little bit because I think it's a little difficult for them to see. So turn your head to the front, just like that. And what I do, I just track it up on the skin. When she starts to heal, she's going to have some tracking marks. I know you can't really see, but it's got like a little waffle at the tip. So when she starts to heal, she's going to see the little waffle marks and those 64 little electrodes that I was talking about that go into the dermis. She's going to have little tiny pinpoint scabs when she starts to heal. And that'll exfoliate naturally in the next 7 to 10 days. And she can go to work, she can put her makeup on, and nobody will be able to tell that she had anything done. So it's great. That's why you can come in during your lunch, get it done, go back to work.
Can everybody see that okay? If we wanted to do a really aggressive treatment, if you wanted to get a really, really aggressive treatment, there's no downtime. You can go back to work, but a day later you may look a little bit like you ran into a screen door. Just a little bit, just a little bit. That's like a really aggressive treatment. It's kind of cool because your friends say, "Oh my gosh, what did you do? Are you okay?" You go, "Yeah, that is great. You made your treatment. It's amazing. You look 10 years younger." And they start sending their friends in. It's kind of cool.
Yes. And it's great. For stretch marks, and a lot of people who have the pitting with the acne scars, this is a great procedure for that.
Acne scars, stretch marks, skin improvements. How's that feeling, Miss Atlanta, Georgia?
I thought it was on standby because I barely feel it.
She can barely feel it.
Okay, I'm going to start turning it up on her.
So again, the marketplace in Dallas, Texas, these cost about $700 to $800 a treatment. I know National Laser, we do more discounted treatments, so we're about $495 if somebody wanted to come in with ED or AV to get his treatment. And if somebody wanted to come during our school training sessions, I believe it's $195 if they want to come in during a school training session. If you become a provider one day and want to utilize this equipment, the cost of this equipment is about $65,000. You'd have to put down probably 20%, you'd have to put down about $10,000, check, cash, credit card payment, and make payments of about $1,500 a month. Which means you have to treat about 3 clients a month to pay for the cost of the device. There's also a consumable that she mentioned that, so each time you treat somebody's full face, it'll cost you as a provider probably $70. You have a cost of $70 to actually do the treatment. Yes, right here. Yes. Anybody in the state of Texas can perform this procedure. You do not have to be a medical professional. You don't even have to be an esthetician. The way the laws work in the state of Texas, if you're thinking about, well, let me ask, is there anybody in this room that's contemplating one day, maybe they're considering getting this business as a technician or provider, part-time, full-time? Anybody out there? Okay, cool. So that's a great question then. The regulations, just to give you guys a handle, what the regulations are in the state of Texas. If you're ever considering being a laser technician and working at a medical spa or doc's office or a fitness center or gym and doing something like Evie or Amy does, you have to go through hours of education. You don't have to be a doctor or a nurse or esthetician or cosmetologist. You have to have hours of education that the state mandates. So basically, there's about 5 days of classroom education, 40 hours. This young lady is actually going through right now, who's on the table. And then it's about another week or so of clinical treatment. So it's basically about a 2-week program to kind of knock out everything that's the latest and greatest. And those are things like laser hair removal and photofacial skin rejuvenation. Now, just so you guys know, I know everybody's heard of laser hair removal, but just as an FYI, the FDA, which is the Food and Drug Administration, they did not approve the term laser hair removal. They approved the term laser hair reduction because when they did the clinical studies, 100% of the hairs in somebody's body didn't go away. Maybe it was 80% or 90% or 99%, but they couldn't call it removal because the FDA said, no, there's some hairs left. So the technical term is laser hair reduction, but all the marketing you see out there is laser hair removal. Hold that question for 1 second here. The second most popular procedure after, when we talk about Botox, it's the number one service in the world, obviously, then dermal fillers, then laser hair removal. After laser hair removal, skin rejuvenation is next. So there's not just skin rejuvenation radio frequency, there's intense pulse light, there's lasers, those for age spots, sun damage, broken capillaries, hyperpigmentation, rosacea, uneven skin tone. Closely after that, services that are popular is vein reduction, meaning that the small spider veins of the body go away with radio frequency devices and sclerotherapy with needles. We also do body contouring. Surgeons do surgery. Plastic surgeons do liposuction and laser liposuction. Well, there's non-surgical procedures for fat and cellulite reduction. Obviously, they don't work as good as the surgery, but they don't cost as much either. Liposuction may cost you $5,000 or $6,000. A non-surgical treatment that maybe freezes fat or melts fat or gives you a good result, not a great result. On a 1 to 10, if liposuction is a 9, a non-surgical procedure may be a 4, 5, or 6, but also maybe it costs $300 to $500 instead of $3,000 to $5,000. And there's no anesthesia, there's no hospital risk and things like that. So body contouring is an up-and-coming thing. Also, tattoo removal. Tattoo removal has become a very, very, very big procedure. As you guys know, in the state of Texas and where I live, there's tattoo parlors everywhere. You drive down the street, there's a Starbucks, there's a cell phone store, there's a 7-Eleven, there's a Walmart, Kmart, and there's a tattoo parlor right in the same block. So a lot of people have tattoos. A lot of people want to get them removed. There's a study done, a dermatological study a couple of years ago. They did a focus group of 2,000 people. And out of the 2,000 people that all had tattoos, 45% of them wanted 1 or more tattoos removed for the following reasons. This is a true story. Number 1, what was so cool at the age of 18 isn't so cool at 30, 40, or 50. Number 2, the guy they were dating, a girl they were dating, who